But anyway, okay, let's start at the top. So hi, everyone. This is Serena from California. And there's our agenda on the screen. So I want to start with state updates, and I couldn't really think of any very clever question for our update. So how about if we just share kind of like how you're feeling as the new school year starts, what's on the horizon, anything you're really excited about or anything you're really concerned about, just sort of what's like foremost on your mind as we kick the year off. And since I can see, I think the list is in alphabetical order, but let's start with Allison.
Okay. Can you hear me okay? I always wonder if everybody can hear. Okay. So here in Massachusetts, we are a new and emerging advocacy group and state affiliate. It's been very complicated with a former group that's here as well that's really not functioning. But we did in August, a colleague and I had a meeting with like the big people at Partners Healthcare here in Boston out of Mass General Hospital, and they are committed to, we just got an email 2 weeks ago, they're committed to support us both with going forward with structurally kind of helping us with being a fiscal agent, or if we have to get our own 501(c), and possibly financially. So we don't know exactly what that means yet, and but it's exciting that we had some big people at Mass General Hospital wanting to support us. So now we're trying to rally the troops in the new school year and develop just an updated kind of list of all of the friends and all of the people that work in school-based health centers, and we have some support now, which is great.
So Allison, is this like a reconstitution of MASBAC?
Well, yeah. So it's been a difficult time in Massachusetts, like with the Mass Association, and the Mass Association has not been active for 2 to 3 years. There's no membership. I've reached out. I'm a leadership fellow right now with the School-Based Health Alliance, and I've used that to try to reach out to connect you know, there, and it's just been met with, we don't have any support or money. So really kind of coming into the current system and looking at being an affiliate with the School-Based Health Alliance, getting some support from across the country, like not reinventing the wheel, but let's look at what's kind of breaking news, policy, you know, federally. That's really been met with the Massachusetts Association, which is really one person and 3 people on a board, wanting to stay focused on the line item at the state level. So really want to stay focused on that and not look at all the other, what people that are working in school-based health right now really want is a network, and to look at best practices and look at measures and stuff, and so that's not being done anywhere. So we're kind of looking at organizing in a big, you know, a more overarching umbrella, and hopefully sometime down the line we can, you know, work together. But right now the Mass Association is not an affiliate, so we have kind of said that we're the Massachusetts Alliance of School-Based Health, and so we are emerging as a new affiliate. So it's kind of complicated.
Good. Well, thank you. Thanks for the update. That's new news from Massachusetts, so I didn't realize all that was happening. Okay, I cannot tell how many people are on the call because my list keeps just, I don't know what's wrong with the list. But so I don't really know how many people we have, but let's try to keep our updates to like a minute or 2. Heidi, you are next on my list.
Sure. So Heidi from Illinois, and I'd say top of mind is, unfortunately, we still don't have a state budget, and that impacts both our field as well as our work as the affiliate. We're kind of on a holding pattern to hire a coordinator, which some of you may know. We've had that position open. I don't know if you remember Anna Burnham. For a little bit. Yeah, so we found someone we're really excited to bring on board, and we're just kind of in a little bit of a holding pattern. So that's top of mind. And then exciting news, we're part of the original cohort of the policy collaborative, where we're planning a managed care kind of panel discussion where we're going to have folks from our Medicaid agency, IDPH, the different health plans, and then give an opportunity to folks in the field, particularly those working in the contracting and billing side of things for school health centers, to ask questions in a facilitated discussion format. So we're excited about that event.
That is cool. You know what? Both of you mentioned managed care plans. You're making me want to have another work group on managed care, because we are also working on that, but it's just hard. It's like a big struggle for us.
Yeah.
Okay, Kathy.
So updates real quick. The school-based health centers in Delaware, 29 are funded by public health, and we all took a 7.5% cut for this fiscal year, with some indication that there might be more to come. So there's a lot of conversation around new models and path forward and support and how to finance it all. So lots of work done over the next couple of years.
Wow, yeah. Okay,
Kathy,
thank you.
Kathy, it's John. You guys lost Fred too, right? Did he retire?
Fred went to HIV surveillance, so he moved within the same division, different section.
Gotcha.
Yeah.
And this is Nancy from New Mexico joining. Just want to let you know.
Hey, Nancy. Okay, you know what? Why don't you go next, because you're not on my list, but I hear your voice.
And I'm sorry, what am I going next? It's just updates in our state?
Just updates. What's on your mind, really? Top of mind, yeah.
Well, we just left, and the reason I'm late, I'm sorry, and Kim will be joining here in a little bit. She doesn't have Bluetooth, but we just left a meeting of our Primary Care Association's billing committee, and we're struggling with this issue of how to identify school-based health center visits, which is why, obviously, our state is so focused on the National Place of Service Code. And it's very interesting. I mean, literally half of our SQHCs represented are not identifying their school-based health center visits separately. So our Medicaid office can't see where those visits are happening, because they all get lumped in. And some folks think it's the managed care organization's fault. Some people think it's the EHR's fault. And so we're trying to sort out some workarounds for now, and hoping that the National Place of Service Code will be an eventual solution. But we feel good about this meeting because it's the first time we've actually dealt with the people who do billing and claims, and they had some really interesting feedback and suggestions. So that's a lot of what we're spending time on right now, is working with our Medicaid office and our managed care organizations to try to make sure that school-based health centers bills get paid, claims aren't denied, and that we can identify the data.
Cool. Very interesting. Let's see. Marilyn. Wait.
Hi, this is Dr. Sinsinski. I'm on the call in place for Nicole Johnson.
Oh, okay.
Not too much. Oh, go ahead.
Okay, wait. Let's go. Did Marilyn, are you on?
Yeah. Yeah.
Okay.
So,
why don't you go next?
Okay. So the members of the state association joined together with the Public Health Association, and we've had 2 meetings together this summer to talk about how to really encourage the development of population-based goals for our school-based health centers. And so for annual meeting, which happens in December, that's one of the things that we're going to focus on, is some of the ideas that we've gotten from the Ohio Public Health Association about how to have population-based goals so that we're really truly reaching out to the whole school at each of our locations. Another couple of things that are happening in Columbus, Ohio has had a mobile operation primarily through Ohio State University for school-based health centers, And now the Nationwide Children's Fair is really going full force and fast forward on developing some school-based health centers in the Columbus area. So we got some great growth happening there, some continuing growth happening in Cleveland, and then it looks like we're probably going to add maybe 3 additional sites here in Cincinnati. So a lot of growth is happening. Our association, I think very much like I was just hearing a couple of people talking about, our association is struggling because of shifts in people and their roles, and maybe that's something I would suggest we talk about. We are a 501c3, and so one of the things I'm spending a lot of time doing is making sure all the T's are crossed and the I's are dotted on the 501c3. So I'd love to have a discussion about how to use that in a way that's helpful for our growth.
All right, gosh, there's several follow-up questions I want to ask you, Marilyn, but I'm going to refrain so that we can keep moving on. But maybe we could just, I guess I'm hoping that at some point we can talk about those population health goals and just how that might be connecting with the national work. I'm just curious about that. But let's move on. So did I skip Kelly? Are you on, Kelly? I don't see a phone by your name. Okay, let's go on to Maureen, who I also don't see a phone by her name.
Hi, this is Maureen from Oregon.
Hi, Maureen.
We have a contract with the state that we're starting to kick off some interesting projects. One is to continue the alternative payment methodology project I've been working on that's specific to SBHCs, so I won't talk about that. But another one that I'm working on is convening regional meetings between our local ACOs and SBHCs, and we're going to be doing a number of meetings over the next 2 years that I think will be really interesting and will give us a lot of information about you know, more ways to improve interactions between SBHCs and the ACOs.
Oh, wow. Okay, that's also fascinating. There's so many things to talk about here. All right, let's see. Maureen, who do I have? Do I see? I can't. My list is so weird. Stephanie, I see your name.
Hey, this is Stephanie from North Carolina, and I hopped on late, so I wasn't sure what the prompt or question
was.
Just
general update, what's on your mind. It could be like a challenge or something great that's happening, kind of just like what's top of mind for you right now as the new school year launches.
Okay, so we are in the throes of planning a school-based health center summit in North Carolina, and we have about 300 people from across the state on our invitation list, and our hope is that we'll have 125 to 150 people from across the state come to the summit, and the goal is really to sort of jumpstart and re-energize thinking around school-based health centers and how do we either develop new partnerships around school-based health centers in North Carolina that help them to be more sustainable and help us to grow them, or you know, really kind of like we have everyone from legislators on our invite list to leaders within state agencies and organizations to our school-based health center folks that are on the invite list. So, so we're just hoping that, again, new partnerships might develop as a result of the summit, and that it'll be a time to sort of, we've had a lot of turnover in leadership at the state level for state agencies and organizations, so we're hoping that it'll be a time to just re-educate folks about who we are and what we do and how we can grow school-based health in North Carolina. And
very exciting.
Yeah, it is exciting, and John Schlitt has been part of our design team and planning team for this event, and he is also going to be one of our primary speakers, and so we're excited about that, and lots of the design, we call them design team calls, but there's been lots of very similar kinds of questions related to ACOs and how school-based health centers fit into that in those planning conversations as we think about what kinds of things we want to bring to the forefront for all those key stakeholders to think about during that day. So it is exciting. It's a lot of work, but it's very exciting.
Good, thank you. How about Tammy?
Okay, really quick, we have our annual conference October 8th and 9th, and Serena Reckling and John Schlitt will be out in attendance helping us with that conference. We're very excited about that. And as Maureen said, we have a state contract, and I'll be working on a mental health summit because we've seen a great expansion in mental health providers in the school-based health center. So we're going to be surveying the field and seeing what they need, and we'll be providing a very specific conference or summit just for them. And also we're going to do our first major survey of the field to try to get a handle on what they need for from us as an alliance, either in the way of advocacy, policy work, technical assistance, and training. So we're getting ready to launch that too. So we're pretty busy.
Wow, that's great. Let's see, Sarah, can you talk now? Maybe not. Okay, I'm sorry I didn't hear your name, who the person who's on for Nicole.
This is Sapna.
Sapna?
Sapna, yeah.
Okay. Would you like to update?
Yeah, sure. Not too much, just we recently applied to the state MSDE, the Maryland State Department of Education, to get our level funding for the year, and then we're working with Kaiser Permanente to see if we can find some funds to do a statewide needs assessment for school-based health centers in Maryland. So that's kind of it right now. Just starting our general board of directors meetings. We'll have our first one of the year starting next week, and then begin our planning committee for our annual conference, which is held in May.
Great, thank you. And I think Lori, I don't think we heard from you, did we? But I don't see if, are you there? All right, is there anyone who can be heard who I've missed? Okay, Serena, I don't know, I can't, sorry, go ahead.
This is Holly in Washington State.
Oh, hi, Holly.
And I'm just putting my voice input in the conversation, but I actually don't have anything to report from the Seattle side, except they're not in school today because of a strike. So,
right.
So our state organization feels like it needs a boost in some form. I think everyone is so busy in their day-to-day jobs that the state is suffering from that.
Mm-hmm.
But I'm very interested in hearing what everybody has to say.
Yeah.
Thank you.
Okay, thank you. So I'll just give a quick update from California. We also are feeling a little stressed at the association level because we are down several staff people. So it just, I don't know, just creates an overall stressful sort of an environment when there's just not quite enough people to do all the work. But some of the things that we're doing that might be of interest to people, we have a big project on trauma that's launching in Oakland, and so we're looking at appropriate trauma screenings, trying to promote the idea of universal screening, but figuring out what's the right tools to use and do it in a way that makes sense. Also looking at screenings in the school-based health center and how should providers be thinking about trauma. That's a huge topic right now in California. We also are continuing a big project on asthma, and I hope that all of you saw the indoor air as environmental triggers reduction guide. That's something that we worked on with a partner here in California, and so that's now available to everybody, and we really want you to take this little survey before you read it because we're trying to report back to the funder on outcomes. Another project that we have is more furthering our work on youth engagement, and so we have a new guide that is for training youth health workers, but it also has some components around health careers because that is a really big thing here in California. Everyone is worried about the diversity and just the strength of the healthcare workforce, so there's a lot of attention to how to get young people interested in health careers, and people see school-based health centers as a potential partner to play a role in that. And so we're trying to figure out what that looks like. So we have this curriculum where we're going to try to bring some professionals in to work with some of the youth in the school-based health center and just give them little exposures to different health careers. So those are just a couple things that we're doing. And I think I'm going to pass it off now to Serena to continue on with the dashboard exercise, unless there's anyone else who can talk who we've missed.
Yes, Nicole Fairchild, are you on? I am. Sorry, I was late.
Oh, hey, Nicole. Do you want to give a quick update?
I don't really think I have anything to update other than we're meeting about our policy learning collaborative and looking at some exciting things with that, getting our work plan together. That's probably the only news right now.
Okay. Good, thank you.
Great.
All right, Serena, take it away.
All right, so as you can see, our internet is not working, but I would like all of you to take a moment, log in to the state affiliate dashboard, and under the document library, we have created a folder called EOB suppression. During the last policy call, this is a hot topic that many of you are addressing. So I would love to just take a few minutes to have each of you upload and share some of the documents that you all have on EOB suppression. And that can be anything from background materials that you've gathered through your own research or specific legislation or regulations that have been passed in your state. So I just thought we'd all powwow and log in and upload some files for the next 3 or 4 minutes before we dive into the policy survey. And I will log on too, just so that you guys can see.
This is really good you're doing this, Serena, because I've already forgotten how to log in. I can't find my password, so.
Uh-oh.
This is good. This is good. This is the whole point, right?
Yep, this is the whole point. Get us all to use it. So under resources, there's a state affiliate dashboard once you're logged in. And then here are all the documents you guys uploaded already. And EOB suppression is empty, and we don't have Kyle on the call, I don't think. So he is approving. Oh, okay, Kyle. So heads up, Kyle. You might be getting a few things on the back end.
Okay.
Is everyone able to log in and upload? Maybe send me a chat message when you've uploaded something so I know that we're kind of wrapping things up. That would be helpful.
This is Allison in Massachusetts. I cannot see when I logged in under my username, I can't see the state affiliate dashboard. I have my member dashboard.
All right, Allison, I will add you to the access list because you're an emerging. I don't think we had you listed.
Okay.
So, Kyle, did you get that?
Yeah, I made a note.
Okay. So, Allison, as you can see, the state affiliate dashboard is a way for the state affiliates to interact with one another virtually. And we have some specific folders that only the state affiliates can see. That's the main difference.
I think I had seen an email and tried to, and it wouldn't let me.
Yeah. Serena, this is Kathy from Delaware. I'm having the same issue.
Okay. For those of you who are able to upload, if you could send me a quick chat message when you've done so, that would be great.
Hey, Serena, are you looking for like a fact sheet? What are you looking for?
So in the last policy call, a lot of, Nancy, New Mexico, and Kathy in Delaware, EOB suppression is a huge hot topic in their state, and there's a lot of conversations happening. And so they're looking for, I think, and Nancy and Kathy, please chime in, just any background materials on EOB suppression that you may have gathered in your own research, or also sample policies that have passed in your state.
Okay.
So this is Heidi, right?
Yes.
Yeah, so Heidi, for example, the legislation that passed recently in Illinois could be something that you upload so people can see what kind of language has passed in other states.
Sure. Thanks.
So Serena, I'm a little bit confused too about when I logged in, I got the member dashboard.
Yes. So it automatically directs to the member dashboard.
Oh, and
you have to go to resources and hit state affiliate dashboard.
Got it. Okay.
Hello?
Hello?
Hi, this is Jessie.
Oh, hi, Jessie.
Hi, are you underway with the phone call?
Yes.
We're having working time, Jessie. We're all supposed to be uploading stuff. That's why it's so quiet.
Okay. I just was able to join just now, so sorry, I was in a meeting. I will mute myself.
I need to play like background music or something doing this. How are things going, guys? Is anyone able to upload? Are you guys working?
I'm really close. Okay, I uploaded something.
Just got it.
Yay.
Anyone else still working on it? I want to make sure I give you enough time before we turn it over to the policy survey presentation.
Okay, Serena, I'm sorry to be so lame, but how do I do another one? How do I get like another?
Is it not giving you the option to upload another one? Because I know that was an issue some people were running into, and we thought we ironed it out.
No, it said your form was successfully submitted. Thank you for contacting us, but I don't see another button to upload anything.
Okay. Did you try refreshing the page?
I will try that.
So Kyle, I don't, this is Nancy in New Mexico. Kim last week uploaded
some things from Confidential and Covered, which I recommend to everybody as a resource around this issue. And I think we're still in a position where you have to approve all the uploads, is that right? So we can't actually on our dashboard see this and she uploaded last week. I don't know if that's because everybody's in it right now or if you haven't approved that yet or what.
I know that that did come through. My colleague Anna was trying to figure out where that was supposed to be placed in the dashboard. So I guess maybe she wasn't able to get to it, but I can go find that and upload it. Which folder did you want that in?
That's the one we're talking about, the EOB. That's for the EOB.
In the EOB. Okay, yeah, I'll add all that in there. Thanks.
And while we're kind of doing this work time, I'll try to go find the website. It's the NIFRA has a special project that's called Confidential and Covered, and they're really focused on family planning, obviously, but they have a lot of resources around this issue that some of the attorneys that are working on our community coalition on this have recommended. So if other folks want to check that out, that not just the one that Kim uploaded, but their whole website is really useful. And I think it's actually just confidentialandcovered.com. It's a sub website of NIFRA, but I'll try to look that up and let you guys know what the site is.
So Tammy just uploaded the Oregon law, and it is for everybody. It doesn't just relate to SBHCs, and the law just passed this last session, so it hasn't been implemented yet, but the language is there.
And Kyle, I'm emailing you the bill language from California because even when I refreshed, I couldn't upload it, but since I'm thinking about it, I don't want to lose this moment to do it.
Thanks, guys, and I appreciate your patience. Yeah, it's a new website, so we're still working on all the kinks. So we'll give it about 3 more minutes, and then we'll hand it over to Suzanne to start on the policy survey findings.
While we're working, can I just ask if there's a good reason to have an approval for the upload, or if that's something you guys are going to get rid of? Because that, seems like unnecessary work for Kyle. If it's just us that has password protected access, couldn't we just trust that we're all going to try to use good sense in uploading things?
Yeah, the reason it's set up this way is it's not that we want to go through here and prove it. It's just this particular plugin for the website. That's just the way it works. But I think Matt and I are going to be looking at different options. That way you all would just be able to upload it yourselves. But in the meantime, this is just kind of what we have.
Gotcha. And it's not that I don't trust that you're going to approve our stuff. It just seems like extra work for you guys that you don't really probably need. I'm sure others do. The other thing, in terms of the forms, Serena, I know this is something you guys were working on in terms of having some trigger alert or email that if someone posts something in the forum, because I think Kim posted things in the forum and we haven't gotten any responses. I know for us, we don't really have time to go check the forum to see if anybody posted something. So hopefully that's something you guys are still looking into to see if that's an option, because I think the forum might not be that useful if there's not an alert system.
Did you guys hear me? I think I just talked on mute. I was just saying that, here on the forum, when you guys open to Kim's email, there's a subscribe button, and that's how you all would subscribe to the forum and see, and pose questions and see what other people have asked. So I think we need some more people to play around with this to see if it works, because if it doesn't, then I agree, Nancy, we have to figure out a different way to communicate. And there's no like automatic opt-in. You guys need to subscribe to it. And I know that Tammy answered the question. And Tammy answered it in a different forum.
Yeah, and Tammy, thank you. I know you and Kim have been communicating on that. Thanks.
You're welcome. I'm trying to actually get a couple more policies for you.
That's great. We sure appreciate it. We don't have a parental consent group per se like you guys do, but we definitely have that population out there, and especially in the community that is currently trying to add reproductive health. So that kind of specific language actually really is well suited to them that you sent us. So thank you.
All right, guys. So we still have Suzanne here to do a presentation. So I'm going to hand it over to her so that we can wrap up by 1 o'clock for the committees.
Good afternoon, everyone. Suzanne. And I'm here to just give you all as the state leaders sort of a sneak peek into some of the data from the fiscal year 2014 state policy survey. The full data will be presented on a webinar next Tuesday, September 15th at 3 p.m. Eastern. So if you have not already done so, you can go ahead and register through our website. So most of you probably know, every 3 years we survey state health departments and Medicaid offices for school-based health center funding, accountability standards, performance indicators, Can you guys hear us?
Yeah.
Now
we can.
Now we can.
Now we can.
Okay, my bad. I think we tried to mute you guys because there's some like background noise, and I think it accidentally muted ourselves. For those of you, if you're not talking, if you could please put yourselves on mute because we are hearing a lot of feedback. Oh, that helps. Thank you so much. No, it didn't. All right, so we'll continue the presentation. My apologies.
Okay. So just to recap, I do want to give a sneak peek into the data from the fiscal year 14 state policy survey. I don't know if you all heard this, but there will be a webinar next Tuesday, September 15th. Which will include the full highlights of the findings. So if you've not already done so, please go ahead and register for that through our website. So as most of you probably know, we do the state policy survey every 3 years. We survey state SDHC program offices as well as Medicaid offices. And we seek to get information around funding, accountability standards, performance indicators, and Medicaid policies. So
do want to start just by showing a map that some of you may recognize from this year's convention in Austin. So this map shows the growth by state of SBHCs since 1998. You can see the total number of SBHCs in each state according to our most recent data, as well as the percentage of growth in each state since 1998, which is color-coded. States with the bars over them are the 18 states that fund an SBHC program. As you can see, while the block of western states in white, for example, are very new in their SBHC growth, states such as California, Florida, and Connecticut have seen an over 200% increase in growth since 1998. So in terms of the data sets for the survey, the State Policy Survey consists of two separate surveys. One is for the State SBHC Program Office, and one is for the Medicaid Office. Maryland's program is run through the Department of Education, while the other 17 states' SBHC programs are run through the Department of Health. There are currently 18 states that report funding an SBHC program, and we only asked these states to complete the survey. We confirmed with all other states that they currently do not fund an SBHC program. We received completed surveys back from 17 state program offices and received partial data from one state affiliate where we could not reach the program office. The Medicaid survey, we also only requested survey completion from those 18 states with confirmed SBHC programs. We received completed surveys from 15 Medicaid offices. So before we dive deep into the funding data, here is a broad overview. The total amount of state investment in fiscal year 14 was $85.1 million, which is a decrease of $4.5 million from FY 2011, which was the last time we surveyed the state. This includes a total of 915 SBHCs that are funded through state programs. On the high end, we have Michigan with total state funding of $13.5 million, which supports 218 SBHCs. And on the low end, we have Indiana with total state funding of $200,000 on 2 school-based health centers. On average, state investment is $4.7 million with 51 school-based health centers funded. Looking at the breakdown of funds by source, you will see that state general revenue continues to be the dominant source of funding, accounting for 80% of total funding in fiscal year 14. The other category in dark brown includes the Medicaid match, which is a source of funds in Michigan and New Mexico, and the Social Services Block Grant, a source of funding in Illinois. Title V MCH Block Grant and tobacco settlement funds constitute the remaining sources of funding. To take a historical view, we can see over time that state general revenue in light brown has always constituted a majority or significant portion of state funding, particularly since 2008. Tobacco funds in light were at their height in 2002 and have declined since then, significantly so between FY 2011 and 2014. See where your state is and compare your state to other states. So this table is one of the tables we've included in our executive summary of the survey findings, which will be released shortly. On the left, there's a column for total SBHCs funded by the states, which was reported by the state program office today. And to the right of that is a column for the total number of SBHCs in the state. These numbers are from the 2014 census survey findings. And the total of 2,350 SBHCs reflects the nationwide total, not just the total for these school-based health centers. So you can see that in some states, nearly all school-based health centers in the state
state funding, such as Delaware, Maryland, Oregon. And in other states, such as Texas or North Carolina, for example, only a small portion of the school-based health centers receive state funding. So for this chart, we looked at the 14 states that have 10-plus years of investment in school-based health centers. On the far right column, you can see the percentage change of funding since FY 2002, and it really varies widely throughout the states. States, Colorado, Michigan, and Mexico have experienced enormous gains, while others, such as Massachusetts, Maryland, and New York, have experienced significant decreases during this time period. So these are the highlights of the funding portion of the program office survey. I'm focusing on for you because I think this is what you probably all are most interested in. I am going to share a few policy highlights from the survey, but I will save most of these for the webinar next week. And if I could ask one more time, if you mute your phones, because we're still getting a lot of feedback. Thank you.
Especially the cell phone users.
Thank you. Okay, so for the state program office survey, one of the questions that we asked, which I'm going to share with you, is what are the top 3 concerns to growing and sustaining school-based health centers? The main concerns that we heard from the state program office include maximizing patient revenue streams and creating a sustainable financial model for SBHCs, followed by maintaining partnerships with schools and local healthcare providers. The lowest ranked concern was demonstrating the value and efficacy of school-based health centers to health insurance and healthcare plans. So in terms of Medicaid policies and school-based health centers, among the key Medicaid policies that we ask about in the survey are whether SBHCs are established as a provider type in code or regulations, the pre-authorization policy for SBHCs, and if Medicaid managed care organizations are required to reimburse and or contract with SBHCs. 8 state Medicaid offices reported defining SBHCs as a provider type, which is an increase of 1 state from the FY 2011 survey. 5 states report that SBHCs are waived from seeking prior authorization from the child's PCP or MCO for all Medicaid eligible services. And an additional 5 states report that SBHCs are waived from seeking prior authorization for a defined set of SBHC services. Both of these categories saw an increase of 1 state since FY 2011. Lastly, 6 states report either requiring MCOs to reimburse and or contract with SBHCs. So that concludes my little sneak peek. Are there any questions? And so I want to preface this by saying that this is just a sneak peek. So if there's data in here that you're not seeing, it will probably be presented at the webinar next week. But if you have any questions on data that I have shown, please feel free to ask. Is there anything
this is great.
that
Thanks.
Thank you. And I'd be interested to know, is there anything that I have presented that, and this maybe is more of an offline conversation, but that is not your understanding of your state's particular policy or funding? Because if that's the case, I want to know, and then see where the discrepancy is with who completed the survey. So if you have a different understanding of your state funding or your state policies, please let me know. So I'm going to take your silence as it's all accurate, which is great. Okay, so hearing none, to hear the rest of the survey findings, just as a reminder again, the webinar is next week, September 15th at 3 p.m. Eastern, and you can register through our website, and that will include a lot more information. Thank you.
Thanks, Suzanne. It got really quiet over there on the other line.
That's because we unmuted ourselves.
So this concludes our monthly call. You know, we've all agreed that we'd like to spend 30 minutes at the end of each hour-and-a-half call. Committees. So I do have one announcement that Ruth Ellis requested that the telehealth committee not meet today because she was unable to lead that conversation. So for those of you who are interested in telehealth, that call is not happening. But there is a call happening for the standards and measures and the communications work group. So I have the phone numbers here on the web page, here on the slide right now. So for those of you that are interested in communications, the phone number is listed on the slide, and then there's the PIN number 2814 that you have to enter. And for those of you that want to talk more about the standards and measures, please dial into the number, which is the same number for all the committees. The only difference is the host PIN and the access code. So note the differences. Let's give each other about 2 minutes to call in to each committee. I'm going to just sit in on the Standards and Measures Committee, and I think Kyle will be also sitting in on the communications. Any questions about this? Are we all clear on what we have to do next?
Serena, this is Jessie, and I don't, if I'm on a committee, I'm unaware, and that probably happened because I was not able to be at the entire day of the state leaders meeting at the convention. So unless, if I am on a committee, if someone wants to let me know what that is, but I'm not aware.
So everyone, we would love for every state affiliate to be on a committee. So if there's a particular area of interest that is of interest to you, you can choose to call into that committee. We had people elect back in the day, and people were hesitant to commit because it didn't quite, because of the extra time commitment, which is why Serena and I decided to fold this into our standing calls to try to get more participation. So Jessie, if there's one in particular that interests you, you are more than welcome to call in. I mean, none of this is required.
Fine.
But
yeah,
it would be nice.
I didn't know if I had signed up for something. I was unaware of it. Okay.
Yeah. So Jessie, is there one in particular that you're interested in? I could just verbally give you that call-in information. And everyone else, I hope you're logging off and calling into your committee.
Serena, I'll be to my office in less than 10 minutes, so I think I'll just call in from there. I'll call into Standards and Measures.
Okay, great. And that number, Jessie, is on the weekly email, so you can just
find that. Great. Yes, I will do that. Okay, thanks.